This is Kirsten Myers Story, about navigating breast cancer with clarity and courage. This series honours the legacy of Kirsten Myers, who faced her diagnosis with determination, deep research, and an unwavering commitment to living fully for her family. Across these episodes, we'll explore the different layers of her time with breast cancer: medical treatments, nutrition, exercise, complementary care, family dynamics, and the power of self-advocacy. We'll bring you intimate conversations with her loved ones and informative discussions with her care team and medical experts. This podcast shares the real stories, the lessons, the moments of strength and clarity. Our hope is that by listening to Kirsten's story, women and families facing breast cancer can feel supported, informed and empowered to make choices that reflect not just their treatment plan, but their values, their bodies and their lives. I'm Peter Birch, and this is Kirsten's story. And it's shared so that no woman has to walk their own path alone. This podcast is intended to honour Kirsten's legacy and provide information that may help others feel informed and supported. Nothing you hear in this podcast should be taken as medical advice. Everyone's situation is unique, and medical decisions should always be made in consultation with a qualified health professional. If you're living with breast cancer or supporting someone who is, please speak to your trusted healthcare provider about your individual circumstances. In this episode, we're joined by Lesley Stafford, an experienced clinical psychologist who specialises in the intersection of mental health and physical illness, with a particular focus on breast cancer. In this conversation, Lesley helps us explore the role of mental health in cancer care and why it's an important part of overall well-being. You'll hear about the common emotional challenges women face at different stages of diagnosis and treatment, the impact on partners and children, and the importance of finding the right kind of psychological support when it's needed. Lesley, thank you so much for joining me today as we're unpacking Kirsten's story. And in this episode, I'd love to learn a little bit more about, or taking the lens of how a patient may look after their mental well-being through breast cancer. But firstly, I'd love to get a bit more context from you. Would you be able to introduce yourself, tell us a little bit more about who you are and what you do?
Sure. Thanks, Pete. My name's Lesley Stafford. I'm a clinical psychologist. So I've been working in the intersection of mental health and physical health all of my career. And for the last 20 years or so, have focused on cancer, specifically women's cancers. And I guess since breast cancer is the most common cancer amongst women, with 1 in 7 of us developing breast cancer in our lifetimes, that's the cancer that I know the most about. So for many years, I worked in the public sector, providing clinical care and also in a research and teaching leadership capacity. And more recently, I've shifted into private practice. So I guess breast cancer specifically is my area of clinical interest, and also the area in which I do the most research. And I have an associate professorship at Melbourne University.
Thank you. I can make some assumptions, but I would love to get from your perspective why it is important for a woman who might, say, receive a diagnosis for breast cancer to have access to, say, mental health services.
So I think, for many people, mental health is considered an optional extra or a luxury. But for me, mental health is health. There is no health without mental health. And it is certainly not an optional extra. It's an integral part of quality of life. And they're very, big reasons for looking after your mental health, because there can be very significant repercussions with poor mental health, particularly depression, in cancer care. So, for instance, we know that people who have depression are less likely to adhere to their treatment. They're more likely to spend more time in hospital. They tend to experience side effects and symptoms more profoundly than people who don't have depression. And I think, perhaps one of the most compelling reasons for me as a psychologist is that when your mental health is poor, your ability to make meaning is diminished. Your sort of ability to appreciate the decisions you need to make and to live life and engage in life in the way you need to or would like to is really suboptimal. So I think there are lots of really good reasons to look after your mental health and not to see that as anything other than integral.
I understand. And there could be many people who have experienced, say, seeing a psychologist or accessing mental health care. There could be a lot of women who might, at the point of diagnosis in breast cancer, never actually experience any kind of mental health services at all. And culturally, or just the way they were brought up, or even just their inherent kind of approach to things, might not even fully understand what it actually looks like and what happens when you receive that care. Are you able to perhaps paint that picture a little bit more about what might be involved in, say, speaking to a psychologist or accessing mental health services at the point of receiving a diagnosis of breast cancer?
Okay, I'm happy to do that. I think I should point out, though, that many people don't need to see a psychologist. So for the vast majority of people, the support that they can receive from their peer group, that means other people in the same position, but also from their friends, and from nurses and other parts of the treatment team, that's often sufficient for many people. So providing education, providing reassurance, providing options for care is often all that people need to know something's available if they need it, or have some reading material around different issues. And then, as you sort of go further up the pyramid, right at the top of the pyramid are people with really complex mental health needs, and those are fortunately in the vast minority. But coming back to your sort of original question about what can you expect right at the start if you were to engage in some sort of mental health treatment? Well, I suppose it depends on where you go and what you do. There are some services that are applicable for everybody. So if we think again of that sort of bottom layer of the pyramid, you could ring sort of the Cancer Council helpline, and they have nurses who are trained in answering most sort of questions at a lower level of intensity. It's an excellent service. The Breast Cancer Network of Australia offers support workers, volunteer workers. So that's one type of support that people can access. But I suppose typically we're thinking about getting a referral from your GP to go and see a psychologist. And so what that involves is, going off to the GP and obtaining what's called a mental health care plan. And that entitles you to 10 Medicare rebatable sessions in a calendar year from a psychologist. It doesn't have to be a clinical psychologist. It can be a general psychologist. And so that's 10 hours from the 31st of December to the 1st of January, well, the other way around, 1st of January to the 31st of December. In the 12 months, you can get 10 rebatable sessions. And, ideally, those sessions will focus on what the patient needs. And, the first session would typically be an assessment, trying to understand a bit about the patient's context, so who she is, where she comes from, her family, her friends, her supports, her lack of support, a bit about her mental health history and how it presents now, her lifestyle, and really understanding, I guess, strengths and vulnerabilities and how she comes to be in the position she is today. And then importantly, understanding what she would like to get from these sessions. So I often say to the women who come to see me, if somebody said to you, oh, I heard that you had psychology sessions with Lesley Stafford, was it any good? How would you know? How would you judge? What would be different in your life? So I think that's a very important question.
Absolutely. And it makes me think, you talked about, I guess, the pyramid of the types of services that can be accessed. But, in learning more about Kirsten's story, I've learnt about, there are a number of stages and different points that a woman might go through in receiving a breast cancer diagnosis. I'm going to assume that for someone who might be first diagnosed, what they might require from, mental health care might be different throughout different stages. Am I kind of on the right path there? I'd love to understand a bit more about how that might change over time.
Okay. So at the very beginning, few people expect that they will be diagnosed with cancer or any other serious disease. So I think all of us, unconsciously wake up in the morning, subconsciously wake up in the morning believing that we will go to bed the same person that night. And then you have a diagnosis of this type and you don't. And in a sense, I suppose we're all okay until we're not okay, and that's very confronting. So things move very quickly in the beginning, and women will often talk about the whirlwind of from the time that they found a lump, if it's self-detected, to investigations, to surgery or chemotherapy or other interventions. And that first sort of period is marked by any number of emotions in any combination. So, disbelief and shock, sadness, anger, fear, all at once, one at a time on a rotation cycle. It's a very confronting time. And then, I think the treatment trajectory is very stressful. It's just the type of stress that differs. And it's sort of curvilinear. So there'd be times where things are a bit better than other times, and then you'd have a scan coming up, and that would make you more anxious, or be waiting on the results of blood tests, and that would again make you more anxious, or you have side effects at different parts of your treatment cycle that can be difficult to manage. So it can be quite a long haul depending on the type of cancer treatment you have and the type of breast cancer you have. And I suppose it's fair to say that few people realize that there's more than one type of breast cancer. I think overall, if we look at, diagnosis, treatment, survivorship, early breast cancer, more advanced breast cancer, there are a couple of themes that are common to all of this. And one theme is loss, the sense of grief. Cancer is in many ways an exercise in loss. You lose very tangible things, bits of bodily integrity, your sometimes your breast or piece of your breast, or both breasts, hair, eyelashes, and those sorts of things if you have chemotherapy. But then there's lots of intangible losses as well, and those range from loss of opportunity, loss of peace of mind, loss of identity, to things like loss of fertility or sexuality. So there's a real real sense of loss that is often a theme running through. And that, of course, can feed into depressive thinking. The other theme is one of fear and worry. And there's a real fear around things like recurrence, that the cancer will come back, or progression for people who have more advanced cancer, that it will continue to get worse, not respond to treatment. There's worry about the future. People, women worry about pain. They worry about death. They worry about things like needles. There's uncertainty. They worry about their kids and their families. So those are the two, the two main themes, I would say, that run right through the whole gamut of breast cancer.
Yeah. And you touched on this earlier before, the different ways to access mental health services. You talked about accessing a mental health care plan, and there's options through Medicare. But I guess in the vast geographical nature of Australia and the placement of different individuals, or perhaps if you're looking into specialised areas, I'm not too sure. I'd love to get your take, I guess, generally on for patients who've are looking to access care, maybe not sure if they they may not be in the close vicinity of easy access. What are some resources or strategies in order to access better care?
So, fortunately, since COVID, we have telehealth. And that has really changed the landscape of mental health care, because it means that in general, people across a vast metropolitan area can see their clinician of choice, even if they live on the other side of town. It means that, provided they have an internet connection, people in rural and regional areas can see clinicians outside of those areas. So telehealth has made a big difference. The problem, though, is a bit more complex than that, in that care is expensive. There's a huge financial burden of cancer care, and anybody who's been through breast cancer will tell you that, even if you go entirely through the public health system. So public health is under-resourced. There really are not many services that would offer a psychologist for women with breast cancer, and so people will then turn to the private sector, where there tend to be quite long waiting lists. There's often a reluctance amongst psychologists to take on this type of work because they are unfamiliar with it, or perhaps afraid that it's all about death and dying, and it's not. And I should have mentioned this before when I was talking about the loss and the fear. There are also good things that come out of cancer. There's this idea of benefit finding, or post-traumatic growth, where people can have much more meaningful spirituality afterwards. They can have a greater openness to experience. They go through a period of emotional housekeeping and have a greater appreciation for their relationships. So there is a real potential for some very positive change to come out of these very stressful experiences. Of course, one can think of other ways whereby one can make these positive changes rather than having to endure a terrible disease. But nonetheless, I should have mentioned that before. So there's there are not hundreds of clinicians around who are keen to do this work. And a good way for people to find someone is to go onto there are two databases out there that are useful. One is the Australian Psychological Society Find a Psychologist database. And so the database allows you to search for by interest. And so you could look for a clinician who was interested in cancer care or in physical illness, those sorts of things. And there's also the Find a Clinical Psychologist database, which operates on a similar basis. So those are two ways you can find a clinician. Let me think what else might be helpful to know in this space. So I mentioned before the Cancer Council information and support line. I think that they also keep a database potentially keep a database, I'm not sure, of people that they might refer to. Most times the GP knows a couple of people that they tend to refer to. There's also an online resource called Cancer in Mind that is a bit of a self-help resource, has information for the index patient, for family and carers, and also for clinicians. So that's another resource that people can consult.
Lesley, that's a great list of resources that we'll make sure are in the show notes of this episode or in the description for people to explore themselves. Something I was reflecting on as you were speaking too, I guess perhaps on the compounding nature of fears and other things that people may bring to those discussions. Sometimes also people may almost feel, at least from I've heard, that perhaps there's a element of guilt around accessing services themselves too. Have you got any advice for if that resonates with someone that might be listening to this episode? How do they kind of work through this feeling that, well, I shouldn't be accessing these kinds of services because who am I to put myself first to speak about these kind of things?
I think we need to understand why somebody's experiencing guilt, and sometimes it is about not wanting to put their needs first. Sometimes it's about stigma attached to mental health needs. Sometimes it's about not wanting to add what they consider more burden to their friends and family. Sometimes it's about wanting to show that they're strong, in inverted commas, and the perception that receiving mental health care is, in inverted commas, weak. And it's not. Seeking help is a strength, and confronting one's vulnerabilities is a strength. So I think we need to understand why that is. I think one of the reasons, the big reasons I see women feeling guilty, is this sort of grappling with the idea that they should be grateful that their situation isn't worse. And, they're aware of other women whose situations are more serious, in that their disease is potentially more serious, and compare themselves to those women and think, well, those are the people. If anybody needs help, it's those people. It's not me. And of course, suffering is not a competition. And so, we need to unpack that a little bit. And two things can be true at the same time. We can acknowledge and be grateful that our own situation is not as bad as another person's, but at the same time acknowledge that it is not as good as another person's as well. And, I come back to what I said earlier on about mental health is health. You cannot have health without good mental health.
Given that someone who is receiving treatment for breast cancer will need to engage with multiple clinicians for different things, and as you kind of suggested already too, even in the mental health side of things, there are many psychologists or clinical psychologists who don't go into these topics for particular reasons. I would imagine there would be other clinicians in other disciplines that may not even have mental health on their radar. Is that something that patients need to grapple with from time to time?
But look, I think it is from time to time. So any person who's been through the treatment process knows that typically oncology doctors are busy and appointments are not as long as they could be, both in the public system and in the private system. And so there's often a sense of I suppose, getting through what is most relevant to that particular doctor. And again, this idea of mental health being not the most relevant thing. I'm pleased to say that we've come a long way in medicine. I think there is increasing recognition, growing recognition that mental health is everybody's business, not just the psychologist's business. Where it becomes more of a problem is in services and in areas where I suppose the clinicians are reluctant to ask about that because they don't know what they would do with that information once they got it back. Because once you've asked and a patient has told you that she is struggling, well, then you sort of have to do something about that. And if you don't know where to go from there, that's a problem. I guess, I always say to women, you need to be assertive. Going to appointments with a list of the things that you want to discuss, and tell the doctor when you get into the appointment that you have a list of things that you would like to discuss, so that they make an accommodation for that in the scheme of the things that they have to discuss with you. And if mental health is one of those things, then put it on the list and raise it. And then when help is offered, though, you have to accept that help. That's the other part. That's, often the missing piece of the puzzle, that we struggle sometimes to accept help.
And thinking further on that, Lesley, for a patient that may receive a diagnosis around metastatic breast cancer, it's I would think that framing almost takes things to the next level. How does that change from a mental health point of view?
So the prognosis is obviously different in someone who has advanced cancer, where by definition an early breast cancer is one where the treatment is has an aim of cure, whereas in advanced cancer the treatment intent is management. It's management of the disease and a good quality of life. And we have made, enormous gains in treatment. So many women with advanced disease can live for many, many years. But the sort of conversations that you would have in a mental health context around being able to look forward to the end of treatment and those sorts of future-focused discussions obviously have to change. So hope is such an important idea, and often the work is around reframing the focus of that hope. So the hope is in everybody's mind, one hopes for a cure, but one often works with reframing that to hoping to get to particular milestones. Focusing on the achievements and the progress of the people around us, often children or partners or friends. So the clinical picture looks a little bit different. But I do want to be, again, absolutely clear that many people can live for a very long time with advanced disease and can have meaningful and enjoyable lives.
In a discipline such as mental health, where by nature it's more emotional and personal and intimate, I imagine, and looking at the different healthcare services that someone getting treated for breast cancer, let's say, there may be some disciplines where if you feel like you don't personally get on with that clinician, it might be okay because there's more other elements that they're looking after. But when you're speaking about mental health, to me, it feels like you'd want to have a really strong connection, not just ensuring that the person is appropriately qualified. What would happen if someone felt like they couldn't make a connection with, say, their psychologist, and have they got options? What do they do then?
Look, I absolutely agree with you. I think that the fit between the clinician and the patient, between the psychologist or the counsellor and the patient, is crucial to the success of the relationship. And, this is it's very privileged work. People who are receiving treatment for cancer are often not very well at all. And for people who have more advanced disease, time is very important to them. So where they are spending an hour of their time with you, we have to take that very seriously. So I think, and my advice to anybody would be that if the person that you are currently seeing, who you're currently seeing, is not a good fit for you, then end that therapeutic relationship. No psychologist, no doctor, nobody can be all things to all people. You won't be the first person who hasn't found that clinician is the right fit for them. It's really okay. So I think I would encourage people to speak up, and one doesn't need to be unkind, but just to say that it's not sort of giving you what you need, and move on to somebody else. And I did talk about those two websites that one can search for people who might be a better fit. I do also recommend to people to see if they can have a discussion with a clinician on the phone before booking an appointment, to get some sense from them of how they work, what their approach is, and to not have to wait for ages to get into the appointment to find out that, you could tell within a few minutes this wasn't really the right person for you.
One thing as well, Lesley, I would think that, for a woman that might receive a diagnosis of breast cancer, many could be thinking about the people that they care for, or family, or kids, and some of these it almost creates, to me, I think it would further compound and make the issues complex. What role does family and kids have in how a woman might process that initial diagnosis?
So I think that relationships shift a lot in the context of a cancer diagnosis. Partners often become carers, and being somebody's carer and somebody's lover at the same time can be uncomfortable at times. Roles shift. If the woman with breast cancer was always the primary caregiver and did most of the things at home, and but now can no longer do those things because of her treatment or her symptoms or her recovery, and the other partner, whether it's a man or a woman, takes on that role, that's another role shift that has to be accommodated. There are often financial role shifts that happen. So there are, they're very big things that happen in terms of relationship. Children is a very sort of special topic, because it's the first thing I'd say that comes to the mind of a woman when she's diagnosed. If she has children, her first thought is typically, what about my kids? Am I going to die? Will my children not have a mother? And, we know that women with children will accept more aggressive treatment for less gain than women who don't have children. So I want to provide a bit of reassurance here and say that most children are not permanently scarred by a parental cancer diagnosis. If you can be open and honest with your kids in a developmentally appropriate way, if you can maintain their routine in as much as possible and be open to their questions, most kids will be okay. We all want our kids to be resilient, but none of us want our kids to go through anything that might make them resilient. So, cancer is awful an experience as it is. It's another opportunity where families, parents have an opportunity to role model how people relate to each other, how people support each other in difficult situations. And so I think it's sometimes helpful to think about it in that way as well.
Lastly, for the woman who might be listening to this episode and feels emotionally overwhelmed or not sure where to start, you've provided some great resources and some suggestions in that respect, and there's been a plethora of insights for people to think about. Is there any other parting comments that you have as they think about the topic of mental health, particularly in a breast cancer diagnosis?
So I think there are a few things that women can do to help themselves. One is that knowledge is power, and I think we need to be judicious in our sources of knowledge. So there are a few places on the internet that are good, reliable sources of information, and the rest are not. And I always say to women, if you have questions about your diagnosis or your treatment or your prognosis, the best person to ask is your doctor. The worst person to ask is a forum. Typically, while forums can be really supportive and really helpful, typically it is unhappy people who are on forums, people who are not doing well, people who are not necessarily going to make you feel good about where things are at. So I think that's one thing that's really important. Another thing is, this idea of gratitude and balancing that with self-compassion. So, we can be grateful that our situation is not as bad as another, that, for example, we live in a first world country with access to first world care, and at the same time have compassion for ourselves that this is still an extremely difficult thing to go through. Having cancer is an abnormal stress. We don't have a template for that kind of stress. So I think balancing gratitude and self-compassion are very important. I mentioned before accepting help when it's offered. I think that's really important. I do like to encourage women to live in accordance with their values. It's hard to go wrong when your values are your North Star. And to make treatment decisions and decisions about how they manage day to day in accordance with the things that matter most to them. Another tip, I guess, is to look after yourself in the very basic sense, which is to get a bit of exercise, at least a few times a week. We don't have to run marathons, but have a walk if you can. Get out. Exercise is a big weapon in the fight against cancer. and eat well. You know, we're talking about just sort of reducing alcohol, reducing the amount of processed food you eat, and, you know, sort of making sensible decisions around what we put into our bodies. And I guess finally, I would say, get help. If you're struggling, if what you're sitting with is more than what you think is reasonable, if you had to think about your best friend and she was struggling with these issues, what would you say to her? You know, would you tell her to just suck it up? Or would you say, I think it's time we talk to your GP, or we talk to your breast care nurse, or something along those lines?
Yeah. Lesley, the topics that we've discussed, through someone's most difficult times in sometimes the most messiest of situations will no doubt be helpful as they follow along Kirsten's story. So I appreciate you contributing. Thank you so much for your time. Thanks for joining us for this episode of Kirsten Myers Story. We hope this conversation got you thinking, or perhaps inspired, about living with courage, clarity, and connection. By sharing Kirsten's story, we hope that you or someone you love feel more informed, supported, and empowered along the way. You'll find more conversations in this series, and please share this episode with someone who'll get some value from it. Through these conversations and the village around her, Kirsten's story continues. If you'd like updates and more information, there'll be some links in the show notes of this episode and ways to continue Kirsten's legacy. I'm Peter Birch, and this is Kirsten's Story.